Heartworm disease, also known as Dirofilaria immitis, primarily affects the pulmonary arteries, which are the blood vessels leading from the heart to the lungs as well as the heart itself. The adult worms cause inflammation, damage to the blood vessel lining, and can lead to pulmonary hypertension, which is high blood pressure in the lungs and right-sided heart failure. The severity of the disease is classified into different stages: mild, moderate, severe, and Cavall syndrome, based on clinical signs. Mild means there are no clinical signs or maybe just a mild cough. Moderate includes a cough, exercise intolerance, and abnormal lung sounds. Severe involves a cough, exercise intolerance, abnormal heart or lung sounds, difficulty breathing, an enlarged liver, fainting, and fluid accumulation in the abdomen. Cavall syndrome is a life-threatening condition where a large number of worms obstruct blood flow in the heart, leading to sudden collapse, anemia, and dark, bloody urine. The disease is transmitted exclusively through the bite of an infected mosquito. The mosquito picks up microfilariae, or immature heartworm larvae, from an infected animal. Then the larvae mature inside the mosquito before being transmitted to a new host. So the presence of this disease really depends on a few important factors, like having a competent mosquito vector, a climate that can actually support mosquito reproduction and larval development, and, of course, a reservoir of infected animals, both domestic and wild canids. Diagnosis usually involves a combination of tests. That typically means running an antigen test, which helps us detect adult female worms, and also a microfilaria test to look for circulating larvae in the blood. Sometimes we need to use additional diagnostic tools, like chest radiographs, which are basically X-rays, or echocardiography, which is an ultrasound of the heart. These help us assess just how severe the disease is and if there's any organ damage. Prevention is honestly the best approach, and the Merck manual really emphasizes that heartworm is a preventable infection. Preventive medications, known as macrocyclic lactones, actually kill the larval stages of the heartworm that have been transmitted in the month prior to administration. This is exactly why consistent year-round use is so important. Preventives are available as monthly oral or topical products, or as an injectable product that's given every 6 or 12 months. The manual also notes that dogs should be started on a preventive early in life, and testing is required for older dogs before starting prevention to make sure they aren't already infected. Treatment is, honestly, pretty complex and requires strict exercise restriction to minimize the risk of complications. The most common and effective treatment protocol involves a 3-dose regimen of melarsamine, which is an arsenic-based drug that kills the adult worms. The manual also recommends the use of an antibiotic, doxycycline, for 30 days prior to the melarsamine injections. Doxycycline targets a symbiotic bacteria called Wolbachia that lives within the heartworm, making the worms weaker and reducing the inflammatory response when they die. The manual mentions non-arsenical or slow-kill protocols as an option in certain situations, but notes that they can lead to lung disease progression and, honestly, the time of the worm's death is unknown, which poses a greater risk. The recommended protocol is still the 3-dose regimen of melarsamine.